Good.
Hi everybody, I'm Dr. Charles Keith and I'm one of the bariatric surgeons here at Tyler Bariatrics and UT Health Bariatric Center, and I appreciate you joining us today as we talk about diabetes and bariatric surgery in particular, as it is it's Diabetes Awareness Month in November. So I guess let's get started.
So what is type 2 diabetes and what causes it?
Yeah, great question. I know a lot of people know, either family members or friends, they hear diabetes out there all the time, maybe even in the news with, the current pandemic. You're hearing that people with diabetes is one of the risk factors for worse outcomes. But I don't think there's a great understanding among the general population of what diabetes actually is. And what diabetes in general is just an inability of your body to regulate the amount of sugar flowing through your bloodstream at any time. And that sugar, you may hear it called glucose. And so what happens is people generally will have high blood sugars or high blood glucose due to their diabetes. And type 2 diabetes is where the tissues in your body don't respond to a hormone called insulin very well. And what insulin does, it's a hormone made by your pancreas. And it goes out and tells all the cells in your body to take up sugar out of the bloodstream to be used for energy and stored for energy. And so when those tissues don't respond to that insulin well, they don't bring in that sugar, that glucose from the blood, and it stays in your blood. And that makes the blood glucose levels or sugar levels stay high. And so that's type 2 diabetes. And what will happen at first is your pancreas will try to work extra hard to make more insulin to make those tissues respond. But over time, it kind of gets worse and worse and it burns out. And that's type 2 diabetes, which is generally what somebody may call adult onset diabetes. And that's the one that's associated with obesity.
What are the risks of living with type 2 diabetes?
Well, there's several risks of living with type 2 diabetes. And so with all that extra blood sugar, circulating throughout your body all the time, numerous organ systems take a hit from that. Importantly, cardiovascular disease. So that encompasses several different disease states, but developing heart disease or having heart attacks, which can lead to heart failure. That's a major one that diabetes contributes to. Also developing strokes is another risk factor for strokes, diabetes. Developing problems with your kidneys, which can lead to kidney failure and then requiring dialysis or even a kidney transplant. There are nerve problems, eye problems, all kinds of issues that come from diabetes over time.
How is type 2 diabetes usually treated?
So generally type 2 diabetes is going to be treated with medications. Early in the course of diabetes, somebody may be able to manage their blood sugars, keep them under pretty good control with different pills. There's several different pills that are out there and new ones that come out that do better each day. And then generally the progression though of diabetes is for it to worsen over time. And so people will start having to be put on injectable medications and then ultimately even injectable insulin, and that's kind of the end stage of this when you're on insulin several times throughout the day.
So how can bariatric surgery help?
So bariatric surgery can help as far as there are several reasons of how it helps, but and that's still widely debated today, and there's a lot of research going into it. The important thing is that we know it does help. We have the highest level of medical research, which is called a randomized controlled trial. And what we've done is there are published studies that show patients who have obesity and diabetes, and they were randomly assigned into 3 different groups. One group got their standard medications for their diabetes, and the 2 other groups got bariatric surgery, one of those being a sleeve gastrectomy and the other being a gastric bypass. And what we've found over time with those patients is the ones who got bariatric surgery do better with their diabetes control. There's other studies that show that patients that have obesity and diabetes improve their heart outcomes. Within just 5 years, they decrease their risk for a major heart problem, being a heart attack, a stroke, developing kidney disease, having a sudden cardiac death. Decrease that risk by 40% in just 5 years. And so we know that it does help with diabetes. In fact, it's the only thing we can do to make diabetes go away. Those medications we take, they can kind of help it stay controlled for a while. But bariatric surgery can actually make the diabetes go away. And so how it happens, we're not totally sure. Is it just the decrease in calories that someone takes? That may be, part of it. Weight loss factors into it as well. But we know it's more than that. There are several hormones that are actually increased after bariatric surgery, which make your body's respond to that insulin better. There's some other hormones that are decreased after bariatric surgery that may be harmful as far as diabetes goes. There's a lot of research going into it. Even just the normal bacteria inside of our gut changes after bariatric surgery to a leaner profile, which also it's hypothesized to help out with our sugar control. So the list goes on, and we don't have a certain answer of how it happens, but we do know that it does happen.
How long after having bariatric surgery does it usually take to see an improvement in diabetes?
Yeah, that's the neatest part about it, and that's one thing that argues weight loss is not the sole thing that's responsible for the diabetes getting better, because our patients, most of them go home with less diabetes medicines, if any, the day they leave the hospital from surgery. So they come in and have their operation, and literally within just days, the diabetes can get much better. So it's not uncommon for us to have a patient come in on diabetes medicines, have their sleeve gastrectomy or their gastric bypass, go home the next morning on no diabetes medicines.
If someone has bariatric surgery and their diabetes goes away, is there still a chance that it could come back?
So there is a chance it can come back, and that's why we call it putting the diabetes into remission rather than a cure. Because a cure, that infers that it's not coming back. Remission means it goes away, but it can come back. So how long it can stay away, it varies. But it's not uncommon for us to see patients who are 10 years out from their bariatric surgery. They were on insulin beforehand, and they're 10 years later still no insulin, no medicines for it, which is absolutely incredible, and especially if you think about how much they've benefited from their heart not having just the constant pounding of all that extra sugar in the bloodstream, their kidneys, going on. That's 10 years worth of better health. And so, but yes, to answer your question, it can come back, and that's what we call remission rather than cure.
Does having type 2 diabetes alone make someone a good candidate for bariatric surgery, or are there other requirements that they need to meet as well?
So in the U.S., for insurance purposes, there are going to probably be some other requirements. In general, pretty much all insurances will cover bariatric surgery for patients who have diabetes and obesity with a BMI or a body mass index of 35 or higher. And if you are uncertain about what your BMI or body mass index is, go to our website, tylerbariatrics.com, and we have a calculator right there where you put in your height and your weight, and it'll tell you. But there are other insurances, and even the American Diabetes Association, who will recommend looking into bariatric surgery as a treatment for diabetes and even lower BMIs or body weights. In fact, when I was in training at Cleveland Clinic, the Cleveland Clinic Health Plan, they would qualify patients or pay for their bariatric surgery at a lower BMI of just 30 if they had diabetes, because they understand just how important it is to get rid of this diabetes.
If someone watching this is interested and wants to learn more or even schedule an appointment, what are the next steps they need to take?
Yeah, so I'd say the next step is go to our website, tylerbariatrics.com. There's a lot of information on there, several videos you can watch. We have a free online seminar there with myself and Dr. Babineau. We're the two surgeons here, and we're asked several questions, and we kind of walk through the process. After you do that, make an appointment with us. Come see one of us and talk with us about it, because everybody is different. Even everybody with diabetes is different, because it does matter how long you've had diabetes, how many medicines you're on, is your sugar level controlled on those medications. That all will really tell you, your chances of being able to put it into remission and which operation may be better for you. So it's very important to go to our website, kind of surf through it. You can go to the American Society for Metabolic and Bariatric Surgery website too. It's asmbs.org, and there's a diabetes page on there too with a lot of great information. But I encourage you to come talk with us. Just because you come to see us doesn't mean we're signing up for surgery, but we can at least tell you, what you could expect after surgery and what would be the best plan for you.
Okay. Those are all the questions we have.
All right. Well, thank you, everybody, for letting us speak with you today. And like I said, please come see us if you have any questions or if we can help.